Tonight, we're going to be talking about a topic that I run into really often in clinical practice. So, we're going to be chatting about why you may be feeling tired even after you've gotten a full night's sleep, or even if you're a really great sleeper. Historically, you tend to get 7 or 8 hours a night. You don't really have much trouble with sleep, but you're still feeling tired during the day. So, a really cool topic. I think there's a lot of talk about sleep and how to improve your sleep, why poor sleep might be impacting your energy levels, but I don't think as many people talk about what else could be causing that fatigue. So I'm excited to get into it with you guys tonight. Okay, so I think for the most part, the people who are going to show up are here. If anyone else arrives later, then I will let them in. And I'm sharing my screen, so hopefully everyone can see the slides. Can someone just give me a little thumbs up or something? Let me know if you can see the slides here. Or you can even jot it down in the chat. Let's see. Here we go. Can everyone see the slides? Yes, thank you. Perfect. Okay. So we should be good to go. All right, so let's get into it. Thank you so much for being here. Welcome to tonight's chat all about fatigue. I'm really happy you guys are here. It's been a while since I've done a webinar, so thank you for coming. We're going to be talking a lot about how to listen to the messages that your body is sending you and how to decode those messages. So, what signs and symptoms may be suggestive or act as clues to let you know what might be going on. So, a little bit about me. My name is Kim. I'm a naturopath at Natural Choice Medical Clinic in Guelph, Ontario. And although I work in the health and wellness space now, I wasn't always very healthy. I would say the first probably half of my life, I was quite sick, actually. And so, after being sick for a very long time, over a decade, I kind of hit my limit and I decided to explore a different path to health. It was amazing because within 3 weeks of choosing this new path, I got greater improvement in symptom relief than I had gotten in over 10 years prior. So it was really my experience that inspired me to become a naturopath and to pursue this career. So I speak from experience. I have gone through the depths of, really challenging health issues. I've been on the other side. I've been a patient. And so that entire experience has really informed the way that I think about health, wellness, medicine. And so I really do believe in a holistic approach in order to get you feeling your best, because that's what really helped me. Okay, so fatigue. No one is really shocked when they feel tired after a late night or after a poor night's sleep. But what if you're one of those people who sleeps really well, doesn't have trouble falling asleep, gets a good number of hours of sleep each night, but you're still feeling exhausted? A very frustrating experience, and it can be super confusing. So hopefully I can clarify some of that confusion today, and hopefully you'll leave tonight with more answers. So I think one of the things that's happened, unfortunately, is that we've normalized fatigue. It's kind of a given in our society, fast paced, lots going on, everyone's super busy. And so we just say, well, it's normal to feel tired, even if I'm sleeping well. And I think that's a really big disservice uh, for just about everyone, because fatigue is an important symptom. It is a symptom of many different underlying conditions. So it's a very vague symptom. There's lots of things that can cause you to feel fatigued, but it's a really important one because it's one of the most consistent symptoms that your body will use to communicate with you. And so we really want to be listening to the messages that our body is sending. If our body is saying, look, I'm exhausted, I'm dragging my feet even though I slept well, you really want to be thinking about why that is, taking it seriously, investigating it, because it's not, I would say it is not normal, even if it is very common. So, what do healthy energy levels actually look like? So, if you have healthy energy levels, you should feel refreshed in the morning when you wake up, and you should be able to get out of bed easily. This is again assuming that you have gotten good quality sleep and you've given yourself enough hours to sleep overnight. You should feel clear headed and you should be able to pay attention without caffeine. You should have enough energy to get through your day, but this is assuming you've given yourself occasional breaks and time for meals. If you're go, go, go all day, you skip meals, you never have your lunch, you work through your lunch, you never take a break, yeah, you're going to feel tired. We're not machines. Our bodies are not meant to function like a machine. We do need breaks and we do need fuel, AKA food. So you should eat 3 meals a day and you should give yourself breaks. But if you've done those things, you should feel energetic. You should not need a nap or need caffeine in order to feel functional. And by the end of the day, you should be feeling tired and, ready to wind down. A lot of people, not a lot, but some people will say to me, like, I'm really concerned because, by 8 p.m., I'm tired. And I think, well, yeah, you should be tired by 8 p.m. It's the end of the day. And, you know, in the past, we would stop our days when the sun went down for the most part. Our days were governed by the rise and fall of the sun. That was pretty, standard. Now, with the advent of artificial light, we're able to work far beyond those daylight hours. But our bodies are still those old bodies that haven't really caught up to all this new tech. And yes, artificial light is considered new tech where our bodies are concerned. And so by the end of the day, when the sun has gone down, you should feel tired. That's normal. Now, what does a good night's sleep look like? You should be able to fall asleep easily. You should not fully wake up overnight. If there's a brief moment where you wake, but you go right back to bed and you're kind of like, half asleep, you don't even know what happened, that's fine. But you shouldn't fully wake up overnight. You shouldn't wake up too early. And not be able to go back to sleep in the early hours, and you should feel refreshed when you wake in the morning. Typically, this requires 7 to 9 hours of uninterrupted sleep for most adults. There are some differences depending on your age. Younger individuals typically need more sleep. We all know teenagers, they need their sleep, they love their sleep. They may need, 9+ hours, whereas senior citizens may, they might only actually need 6 hours. So typically, our sleep needs go down as we age. But for the average adult, 7 to 9 hours is what you'll need. Uh, People who are born with ovaries and uteruses and who have a period actually need a little bit more sleep. So that's something else to be mindful of. If you get a period, then you will need a little bit more sleep than your male counterparts. Okay, so what if you're falling asleep, you are staying asleep, and you're giving yourself enough hours to sleep, but you're not having that nice energy pattern that I described earlier? What to do? First thing, don't ignore it. Don't sweep it under the rug. Take it seriously. As I said, fatigue has been normalized, but that doesn't mean that it is normal. So take it seriously. It's a sign from your body that something is wrong or something is missing, and you should try to find out what that is. You should investigate, and I would encourage you to get the help of a professional, whether that's your doctor, your nurse practitioner, a naturopath, whoever it is. Get help, because it can be pretty challenging to figure this out without proper investigation and testing. And then lastly, pay attention to your signs and symptoms. It's very common that there are hidden clues in there if you pay attention. So, does your fatigue only happen during certain days of the week? Does it only happen at certain times of the day? Does it only happen at certain days of your cycle, your month-long cycle? Do you notice things that make it better or make it worse? These are all really important clues that can help us figure out why is it happening? What's the underlying cause? So pay attention, be mindful. All right, so these are the major possible causes that we'll be discussing tonight. These are not all the possible causes of fatigue despite adequate sleep. There are other things that we won't discuss today, things like, autoimmune disease. That's a really big one. Food sensitivities can sometimes trigger this. So there's lots of possible reasons for fatigue, but these are the ones that I see most commonly in my practice and that I think are often the culprit. So that's why that's why I chose these and why we'll be discussing these particular causes. So I'm going to dive into each of them in a little bit more detail. So let's start off with one that I think is really important to discuss because sometimes it's left out of the conversation, and that is sleep apnea. So, sleep apnea is a condition that causes you to stop breathing over and over and over during your sleep. And of course, if you have moments where you stop breathing, your oxygen levels are going to go down. And when that happens, it actually interrupts your sleep cycle. And people with sleep apnea aren't always aware of the interruptions to their sleep. They may wake up in the morning and have no idea what was going on that night, that their sleep had been interrupted dozens of times, that they had stopped breathing dozens of times. So you don't have to be consciously aware of this to know that it's happening. Sometimes it's happening outside of your awareness. Bed partners will often be aware of it. Some signs are if your bed partner or other people in the home tell you that you snore, and especially if you snore very loudly, if you gasp in your sleep, and if you notice that you tend to wake up with a dry mouth, that's another clue. So this is a situation where you do need to go for a sleep study, and that's something your doctor or nurse practitioner can refer you for so that they can basically have you sleep, and then they can monitor you during sleep to see, do you stop breathing and do you have interruptions to your sleep cycle? And I really think that more people should be asking for sleep studies because sleep apnea is more common than we realize. And if we leave it unexplored, it can have very serious consequences for our health in the long run. It's not something you want to ignore. So, especially if you have these signs and symptoms, make sure that you're asking for a sleep study and investigating. Okay, next one is nutrient deficiencies. I would say that this, in my practice, is the most common cause of fatigue that I see. Now, there's a few different nutrient deficiencies that can trigger fatigue as a side effect, and I'll be discussing them in a bit more detail, but typically, these are really common in people who get a period, especially if they have a very heavy period, in people who mostly or very strictly follow a vegan or vegetarian diet, uh, people who are alcohol lovers and enjoy alcoholic beverages regularly, people who use a lot of antacid medications in order to manage things like heartburn and acid reflux, and in people who have a lot of digestive issues. Now, not all deficiencies, but some deficiencies can actually cause anemia, which is a condition where your body cannot produce enough red blood cells or hemoglobin to meet its needs. And that can cause more severe type of fatigue. So that's another one that I'm seeing quite commonly in practice. So these are the deficiencies that I see very often. We have vitamin B12 deficiency, iron deficiency, and vitamin D deficiency. So let's start with vitamin B12. Vitamin B12 deficiency is particularly common in people who are using a lot of those antacid medications because we actually need stomach acid in order to absorb B12 from our food. So if we are suppressing our stomach acid levels with antacids in order to help with heartburn and acid reflux, we may be contributing to the development of a vitamin B12 deficiency. It's also really common in people following a vegan or vegetarian diet just because B12 is primarily found in animal products and it's more difficult to get from a plant-based diet. And then we'll also see this in the alcohol lovers, as I mentioned earlier. So some signs of vitamin B12 deficiency. You'll notice that there's a lot of crossover between the signs that can indicate each of these deficiencies, which is why investigation and testing is so important so that we can differentiate. But there are some that are unique to each. So for vitamin B12, we may see shortness of breath. We may see some weakness in the extremities or in the muscles, headaches and low appetite, numbness and tingling, especially in the extremities. This one is a little bit more specific for vitamin B12 because vitamin B12 deficiency can have an impact on your neurological health. So we'll see some numbness and tingling. You may notice a smooth and tender tongue, ulcers and sores around the mouth, the corner of the mouth. Sometimes you'll see that. Reduced vision or just vision troubles in general, and then memory troubles as well. So those last few in the list are more unique for vitamin B12. Luckily, we can diagnose this pretty easily. Just need to do a quick blood test, test something called CBC, which stands for complete blood count, and vitamin B12. And we can diagnose it really easily just by doing that. Your doctor can do that, your nurse practitioner can do that, a naturopath can do that. Okay, so the next one here is iron deficiency. I see this a lot in my patients. I do primarily treat people with periods, so that is probably why I see it so often. If you think about it, we lose iron very regularly each month when we get a period because we lose blood, and that is happening for a very large proportion of our life. And so when we are losing blood consistently, we become much more vulnerable to an iron deficiency. And so that is why it's so common in people with periods. Is also common in people who follow a primarily plant-based diet, vegan or vegetarian, and that's just because iron is found in high amounts in animal products and in lower amounts in plant-based foods. And, a lot of people will say, yeah, there's a lot of iron in things like spinach, and yes, there is, but it's not nearly as much as you find in animal products, and the actual type of iron that's found is much less bioavailable. It's much more challenging for your body to absorb. The iron that we find in animal products is heme iron, and that's the exact same type of iron that our body uses. So we can just absorb it directly when we eat the food, assuming that our digestive system is healthy. So that's why vegans and vegetarians tend to be much more vulnerable to developing this. And then we'll see this a lot in people with digestive trouble. And that's just because iron is challenging for our bodies to absorb just in general. And so if your digestive system is not functioning properly, and if your digestive system isn't absorbing nutrients well, you are much more prone to getting an iron deficiency. I see this a lot, especially in people with celiac disease. And, if you are the kind of person who has had an iron deficiency, a long-standing one, for quite a while, and it just never really budges, that's a situation where I'm always thinking about testing someone for celiac disease. I've caught a few cases of undiagnosed celiac disease just by using that strategy. So digestive issues and nutrient deficiencies do often go hand in hand. Some of the signs that you may have an iron deficiency include pallor, shortness of breath, feeling very cold, especially the hands and the feet, feeling weak or dizzy, having a fast heartbeat, depression and anxiety, feeling particularly tired after physical activity, noticing, hair loss or thinning of the hair, and then very weak or brittle nails. Those are all possible signs of iron deficiency. So, this can be diagnosed with a few blood tests as well. You will want to test things like the CBC, which I talked about for vitamin B12, as well as something called ferritin. Ferritin is a marker of our iron storage. So, how much iron have we stored away in the body to be used? And then something called iron slash TIBC. This one's a little harder to get through your doctor unless you have a history of anemia. It may be less likely that your doctor will test this one. I always test this in my patients, and the reason is that ferritin, although it tells us how much iron we have stored away, it's also something called an acute phase reactant, which means that it will go up when there's a lot of inflammation in the body. And so if someone is inflamed, their ferritin will be higher than it would be. And so sometimes this can mask an iron deficiency. So we'll look at someone's ferritin level and say, actually, your ferritin looks pretty good. Looks like you have lots of iron stores. I don't think you need extra iron. But in reality, there's just a lot of inflammation going on and that ferritin is being elevated. So I like to test iron slash TIBC because it's unaffected by inflammation. So for me, it gives me more peace of mind that we are really, doing our due diligence and we're not missing anything. All right, the last one I have on here is vitamin D. So, vitamin D is unfortunately a common deficiency we see here in Canada, and that's just because we have long winters with not much sunlight, and the quality of the sunlight we get in the winter is just terrible, frankly. So, it's very difficult for us to sustain healthy levels of vitamin D over here. Just because of our global positioning relative to the sun. So this is one that I'm testing for in pretty much every patient. Basically, if you live in Canada, I think you should have your vitamin D tested regularly. So signs of vitamin D deficiency include depression, anxiety, being frequently sick or getting lots of infections, having really poor recovery after illness. Like if you catch a cold, but then it takes you like 3 weeks to recover. Uh, Hair loss and hair thinning, you'll notice that's a common one. Weakness, aches and pains in the body. And if it gets bad enough, you may have bone pain or bones that fracture very easily. So this is another one that can be easily diagnosed with a blood test. It's the 25 hydroxy vitamin D test. So again, that's one I'm running all the time for my patients. All right, so let's talk about a few different dietary strategies in order to get your deficiencies improved. So for vitamin B12, shellfish, really great source of vitamin B12. Oily fish, so I have in parenthesis there smashed. This is a little acronym you can use to remember which fish are considered oily fish. So that's going to be salmon, mackerel, anchovies, sardines, herring, and trout. You may be wondering, why isn't there a T for tuna? Yes, tuna is considered an oily fish, but it also comes along with quite a bit of mercury. Unfortunately, mercury levels are quite high in tuna, and so it's not one that I'm recommending as part of, a very regular diet or something I want to be encouraging people to eat a lot of. I would say keep tuna to max once a week, and even better, try, if you really love canned tuna, try to do canned salmon instead because you're not going to have to worry about the mercury the way you would with tuna. So that's why tuna is not on my list. Then we have beef, eggs, chicken, tofu and tempeh, soy milk, nutritional yeast, and Marmite or yeast spread. You may notice I wrote organic unsweetened soy milk there. I'm not too picky about organic versus conventional. I find I just want my patients to eat healthy food, regardless of whether it's organic. But when it comes to soy, I do get picky. Better to stick to organic. I will say, if you have a true vitamin B12 deficiency, it will be very challenging to correct your deficiency with diet alone. Supplementation is generally needed, but you really want to be testing your levels to see where you're at, because depending on where you're at, diet might be enough, but if your deficiency is significant, then you may need more than that. Okay, iron-rich foods. So a lot of people probably know some of these right off the bat. Red meat is the biggest one, usually the one people think about. I like to ask people to stick to grass-fed as much as possible. All seafood, but especially oysters and shellfish, beans and legumes, dark green leafy veggies, dark chocolate and cocoa powder. I do have in parenthesis here to watch out for heavy metals. A few years ago, a report came out, and basically what they did was they tested the levels of heavy metals in practically every brand of chocolate on the market in North America, and dark chocolate, almost every brand that made a dark chocolate product came back with unacceptable levels of heavy metals, much higher than they should have been. And so I'm really cautious with the dark chocolate that I recommend for my patients so that they can avoid those heavy metals. The brands that I like are Choco Sol, Mast, and Gideo. Those three brands do regular testing of their products, and they release the test results to the public. The tests are done by a third party, and they always come back under the limit or at zero. So those are the brands I encourage you to stick to. Quinoa, mushrooms, pumpkin seeds, squash seeds, sesame seeds, peas, and liver. If you are pregnant, don't eat liver. It just has a lot of vitamin A, and you don't want to get high amounts of vitamin A in pregnancy. So similar to what I said about B12, if you have a true iron deficiency, correcting that deficiency with diet alone will be challenging. Typically, you need a supplement, but that doesn't mean that you want to go out and buy an iron supplement just to kind of cover all your bases. Iron can cause a lot of problems if you take too much or if you have too much in the body. This isn't a supplement that you want to just be taking willy-nilly. You want to test your iron levels, and if they come back deficient, then you can take an iron supplement, and your doctor, nurse practitioner, naturopath will guide you through that. All right, last deficiency, vitamin D. So we synthesize vitamin D through sunlight exposure. So sunlight is the best way to get vitamin D. There are some foods that have some vitamin D, but sunlight is really the primary way to accomplish this. So you want to get at least 30 minutes of sunlight first thing in the morning, and this is regardless of weather or season. Yes, the amount of vitamin D you will synthesize in the winter will be dramatically lower than in the summer, but it's better than nothing. And in order to synthesize that vitamin D, you really do need to go outside. Getting light through a window is not sufficient. Unfortunately, windows will severely dampen the synthesis of vitamin D from sunlight. We really do have to go outside. This is also a really good practice for your energy levels in general, though. And this is because, our bodies really are adapted to rise with the sun and fall with the sun. And we have something called a cortisol awakening response. So in the mornings, we should get a nice spike in a hormone called cortisol. And a lot of people think of cortisol as a bad thing because it is our major stress hormone. And they say, oh, we don't want a lot of cortisol. That's bad. But we actually do want a spike in cortisol in the morning because it's what helps to get us up and out of bed, give us energy to get our day started. And that cortisol awakening response is very reliant on exposure to sunlight in the morning. That morning sunlight will stimulate the cortisol awakening response. And so getting outside, going on a walk first thing in the morning is really going to set you up to get a nice, healthy cortisol awakening response and help you get a little extra vitamin D. People who have dogs often are very lucky because they just kind of get to do this automatically. They have to take the dog out first thing in the morning, and so they get their morning sunlight by going on a quick little walk. Some foods that also have vitamin D. We have the oily fish again, mushrooms, pork, eggs, and a lot of foods that are fortified with vitamin D as well. Again, if you have a vitamin D deficiency, trying to get your vitamin D from diet alone is unlikely to be successful. So you'll probably need a supplement. But just like I talked about with iron, vitamin D is not a supplement where you want to be going out and taking really high doses without testing, because vitamin D can become toxic if you get too much. So don't just go to the store and take huge doses of vitamin D thinking, I'm Canadian, I need it. Get your levels tested so that an appropriate dose can be determined for you. Also, everyone absorbs vitamin D a little bit differently. Some people have amazing results from low doses, whereas other people need much higher doses. And this is something that can only be determined by testing your vitamin D levels and recording your progress after you initiate treatment. So I really do encourage you to work with a professional who can help you get the results you want and track your progress so that you're taking appropriate amounts of different supplements. Okay, so next topic, thyroid health. Our thyroid is a very big contributor to our overall energy levels. And if you are sleeping well, but you're still feeling tired, your thyroid could be to blame. And this is because when your thyroid gland is under functioning, everything slows down, including your energy levels. And so your thyroid is this little butterfly shaped gland at the bottom of your throat. And it's involved in so many things, but, regulation of your metabolism, even your body temperature and your energy levels. It's involved in lots of things, but particularly energy. If your thyroid is under functioning, this is typically something called hypothyroidism. It's very common in people with periods, much more common for them rather than their male counterparts. It's also pretty common postpartum. I see it quite a lot in my practice. And also for people going through perimenopause and menopause, I see this a lot as well. So, in addition to being tired, some other symptoms you may see are unintentional weight gain, constipation, dry skin, thinning hair on the head, but also on the eyebrows, and in particular, the outer third of the eyebrow. We say the lateral third, but the outer third will get very thin. Feeling cold all the time. So there's some crossover there with iron deficiency. Achy muscles and joints, a hoarse voice, or like a swelling in the throat, weakness, low mood, depression, and changes to your period. Things like heavy periods or irregular periods. The thyroid's very important for regulation of our menstrual cycle. So, in order to diagnose a thyroid condition, we do need to do a little bit of blood work. The blood test that's often done is something called TSH, or thyroid stimulating hormone. That gives us an idea of what's going on, but I like to go a little bit further because TSH, I feel, is just scratching the surface. TSH is a hormone that's produced by your brain, and it's how your brain communicates with your thyroid. And so TSH tells us what your brain is asking your thyroid to do, and it's suggestive of what your thyroid is doing, but it doesn't necessarily tell us exactly what's going on. It's more suggestive, in my opinion. So we really want to, in addition to testing TSH, be testing some thyroid hormones, which are called free T3 and free T4, as well as some antibodies called anti-TPO and anti-TG. So sometimes when our thyroid is under functioning, it's because of our immune system. And it's because our immune system is attacking our thyroid gland and making it really hard for our thyroid to do its job. That's actually very common. And so, in order to determine whether or not that's happening, we need to test these antibodies, the anti-TPO and anti-TG. So, I really like to run a full thyroid panel for my patients in order to get to the bottom of that. All right. Dehydration, number 4. This is one of those things where I feel like a lot of people, they know they should drink more water, but they're like, yeah, I know, I don't get enough water. And I think we kind of underestimate how big of an impact that has on our overall health, but especially our energy levels. When you're dehydrated, Your body loses fluids and electrolytes more quickly than it can replace them. Uh, and it makes your blood pressure go down and it actually reduces blood flow to the brain. So, of course, you're going to feel more tired if you have reduced blood flow to the brain. Your total blood fluid volume will drop. And so now your heart has to work harder to pump your blood and to deliver, the adequate amount of nutrients, oxygen, fluid to all your cells and tissues. And that also makes you really tired. You're making your heart work harder than it's gotta. And so it's such a simple little thing, but getting enough water can do wonders for your energy levels. So if you're one of those people who by the end of the day is like, oh, I think I had maybe like 2 glasses and some coffee and that's it, please be mindful. Try to get that water intake up. It's such a small little tweak you can make, and it can have a huge, huge impact. Everything that happens in your body relies on water. You need water every step of the way, no matter what's going on inside here. And if you don't have enough water, your body simply cannot function normally. It just can't. It doesn't have the one of the most basic foundational ingredients that it needs in order to function. So we should be aiming for 2 liters minimum per day. If you are very active, you're going to have to increase that. You're going to have to go up to 2.5 to 3 liters because you're going to be sweating and losing more fluid and electrolytes. If you're drinking caffeinated beverages or alcohol, you should count only about half of the fluid volume of those beverages towards your total. And that's because caffeine and alcohol are dehydrating. So yes, you get some fluid when you drink them, but they also cause you to lose a little more fluid. So to kind of counteract that, we count half. If you're very active, especially, you want to be using an electrolyte blend to replace your electrolytes. And if you tend to get a lot of headaches or muscle cramps, these are really good signs that you may benefit from some electrolytes. All right, sedentary lifestyle. This is another really common reason for fatigue. And, I think that we often forget that our bodies are not designed to sit all day. We are designed to travel very long distances on foot and move every day, use our bodies pretty intensely every day. That's what we're designed to do. We're actually long distance runners. That's what we're supposed to be doing. But instead, we're sitting in chairs, looking at our phones and at screens, and it's really at odds. The way our modern society is structured is at odds with the evolutionary design of our bodies, and it's really a bummer because it's not helping us. So, moving your body can boost your energy and mood, and it can do that in a really big way. Causes the release of dopamine and serotonin, which are two neurotransmitters that really boost mood and energy, make you feel good. They're implicated in, lots of mental health disorders. But when we get little boosts of those neurotransmitters, we feel better. We want to be aiming for 30 minutes every day of intentional movement. And when I say intentional, that is movement that goes above and beyond your typical day-to-day chores. Yes, you may be doing some cleaning and, maybe walking a little bit around the home, but I'm talking about intentional movement that goes beyond that. So, choosing to go on a brisk walk or choosing to do a workout or choosing to do some stretching, whatever it is, but trying to move your body intentionally. Okay, probably everyone's least favorite topic when I bring it up, but caffeine overuse. This is very, very commonly at the root of chronic fatigue. Unfortunately, although caffeine gives us an energy boost, it often causes energy crashes, dependence on caffeine to function, and chronically low energy levels. And the reason is that caffeine, although it feels like it's giving us more energy, it's not actually doing that. What it's doing is it's making us unaware of how tired we are. So, caffeine works by blocking adenosine, which is a neurotransmitter that makes humans feel sleepy. It promotes sleep. And so when we consume caffeine, we don't feel those sleepy effects of adenosine. But what happens is that that effect is temporary. So once the caffeine wears off, all that adenosine plus the adenosine that was building up while we were experiencing our caffeine high, all of it hits us at once and we feel exhausted and we get this energy crash. And so when we use caffeine all day, every day, many cups throughout the day, what happens is that we are constantly tricking our body into thinking we're more energetic than we actually are, and we are really dealing with the consequences of that choice later. So the way I like to think about it is that caffeine steals tomorrow's energy to be used today. Unfortunately, this will catch up with you eventually. And something else that I think we often forget is that caffeine is a drug. It's a very commonly used drug that's socially accepted. Just about everyone starts their day with a cup of coffee, but it is a drug. And many of us are unfortunately addicted to this drug and reliant on this drug to get through the day, which is unfortunate, but there are ways around it. I really do recommend taking regular breaks from caffeine. So I like a 2 days on, 2 days off uh, schedule because it allows your adenosine levels to kind of normalize and to help reduce the effect of kind of blocking that adenosine so that you don't become so dependent on caffeine. Because that's often why when you wake up in the morning, people who really need caffeine to get going, they feel completely non-functional until they've had their cup of coffee. And it's because they have all this adenosine sitting around, making them feel absolutely exhausted. And then the coffee blocks it temporarily, but again, it just kind of perpetuates the cycle. I also recommend avoiding caffeine overuse. I would stick to 1 cup per day. Make sure you're consuming that cup before 10 a.m. I don't recommend any caffeine after 10 a.m., definitely not afternoon. And you always want to consume your coffee and caffeine with a meal. Do not consume it on an empty stomach first thing in the morning, which I know so many people do, but it's really not a great choice. When we consume caffeine on an empty stomach, what happens? First thing that happens is that that caffeine gets absorbed into circulation extremely quickly, and it causes a huge spike in cortisol, that major stress hormone. Unfortunately, that spike also causes a really big spike in our blood sugar levels, but that big spike in blood sugar is not sustained, and unfortunately, it will come crashing down. And then we kind of set the stage for a blood sugar roller coaster for the rest of the day, which in itself, is very draining and causes us to feel exhausted. So I really don't recommend it. If you have caffeine, make sure to have it with a meal or shortly after a meal, because that really kind of buffers or blunts the effect of that, blood sugar spike and cortisol spike. Okay, a non-nutritious diet. Another really common one I see in practice. So, it's really interesting. We live in an age where there's a lot of things out there that are labeled as food, but I wouldn't exactly count them as food. I would count them as food-like products. There's a lot of things that are very ultra processed that we have come to rely on because they're so incredibly convenient. But the truth is that the more processed a food is, the less nutritious it is. And so we really want to kind of return back to a diet that our grandmothers and great grandmothers were cooking and eating because they pretty much only had access to whole foods. There was no ultra processed food or food like products available to them. And so we really want to return back to that style of eating as much as possible. And the way I like to think about it is if you're trying to energize your body with ultra processed foods and food like products, it's like trying to use the wrong type of fuel in your car. It's not going to work very well, if at all. Our bodies need specific nutrients and fuel in order to function. And if we're not giving our bodies those nutrients and that fuel, it's a constant uphill battle. So we really want to be feeding our bodies properly. Another thing I see very often is a diet that is very low in calories or macronutrients. I see this a lot in my moms. Uh, you know, I'll ask them what they eat in a day, and they'll say, "Oh, I made a sandwich for my kids, but I cut off the crusts and I ate the crusts." Or, my kids left a couple bites of their lunch and that's what I ate. And I am here to remind you that the leftover crumbs on your children's plate are not a meal. That is not you fueling your body. What you're trying to do in that situation is trying to drive your car without any fuel at all. There's no gas in the tank, and you're trying to drive it, and it's not going to drive. Your body somehow, by some miracle, does continue to drive, but it does so with a lot of challenges. If you were to do this to your car, it just wouldn't drive for you at all. So thank your body for how hard it works for you, but you really got to give it the fuel it needs. Treat it with love and respect. Your body deserves that. So something that I really want to encourage my patients to do is to eat primarily whole foods. And there's a really great way to figure out whether a food is a whole food or not. And that is to ask yourself, does it grow? If you can answer yes to that question, that food is an unprocessed food that is health supportive and is a whole food. So, an apple grows on trees. Um, let's see, a salmon is a fish that grows from a baby to a huge fish. What else? Broccoli, is a plant that grows. These are all whole foods. Cookies do not grow. Sour cherry blasters do not grow. Chips do not grow. So this really helps you to distinguish between what is a whole food and what is not, because sometimes even that can be confusing. Often a whole food only has one ingredient. There's no need for an ingredient list. It just is the thing that it is. And it appears to you in the same form that it appears in nature. So the way a tomato looks when it's growing on a plant is the same way it looks when you go to eat it. Uh, Apart from eating a whole foods diet primarily, and I would aim for about 80-20, that's a good goal, eating a whole foods 80% of the time. We don't need to be perfect, but we want to be doing these health supportive activities more often than not. And we want to be doing it for the majority of the time. We don't have to strive for perfection, but we do want to try to do what will support our health the vast majority of the time. But in addition to that, we want to be eating meals that are very balanced. So that means a meal that contains protein, healthy fat, fiber, and complex carbs. This is something I'm going through with every single patient I go through this discussion. And you want to be fueling your body, eating, solid meals each day. Don't skip meals and try to run on empty. And make sure you're getting enough protein. That's another really common cause for low energy. So that's another one I go through with pretty much every single patient is how much protein should you be getting? How will you get there? That's a really common discussion. All right, another one people don't love to hear, but electronic overuse. Unfortunately, electronics really do expose us to an incredible amount of junk light. And this throws off our sleep-wake cycle. And our sleep-wake cycle is really critical for good energy and good mood. So this is something, again, I talked about it a little earlier, but our bodies have not quite caught up to our modern lifestyle. And all of this tech, all of the artificial light we're exposed to is relatively new if you consider how long we have been around as a species. And we're not quite there yet where we've evolved to manage this. Unfortunately, it really does throw off our natural rhythms and cycles. Our body is extremely sensitive to light. Our circadian rhythm is basically completely dependent on the quality of light that we receive or are exposed to. And so the junk light in our lives. Electronic devices are the most common source of exposure to junk light. It really exposes us to this blue quality light that is particularly harmful for our eyes, but also it tricks our brain. This blue light tells our brain that it's noon roughly. But we're looking at this light, 9 p.m., 10 p.m. Some people are on their phones at 1 a.m., and that is so confusing for your brain and your body. It doesn't know what to do with that information. And that really messes with the levels of cortisol that are released throughout the day, which help to govern our energy levels. And so when our cortisol pattern is all over the map because we're exposed to all this light that confuses our bodies, we won't feel energetic at the right time of day. So often what happens is that people feel tired but wired. So they're like, I'm exhausted. I feel like I'm dragging my feet, but at the same time, I feel kind of on edge and jittery. That's a really common symptom of electronic overuse. Not to mention the content we're actually exposed to, but that's a whole other topic. So here's a picture of me, and I am wearing my blue light blocking glasses here. I know I look like I'm straight out of the 70s. Frankly, I think it's cool, but maybe other people disagree. But I love those glasses. They block 100% of the blue light that is incoming into my eyes. These are glasses that I wear in the evenings for at least an hour before bed. If we're in the summertime, I just will put them on after the sun goes down. These glasses I'm wearing right now are also blue light blocking, but they don't block 100% of the blue light. They only block some of it. So these are the ones I wear during the day, and these fun red ones are the ones I wear in the evening. So I want you to be mindful and, put limits in place to help control the amount of light you're exposed to, because unfortunately, we will be exposed to the light. It's here to stay. Artificial lighting isn't going anywhere. Um, so I recommend setting screen time limits on all of your devices and being really mindful of that. If you can, I would try not to be on your phone for more than an hour a day. You want to be especially mindful before bed. That hour before bed should be, your sanctuary, no electronics. If you can, try to go all the way back to your grandma's time and use only candlelight during that hour. That's what I like to do because the quality of light that we get from a flame is very different from the light that we get from electronics and artificial lighting. And it actually helps to stimulate sleep. It simulates, sitting around a fire in the evening, which we evolved to do before we went to bed. So it's a really nice way to do things. But if you can't have candles before bed, at least try to dim your lights. At least try to reduce your exposure. Wear blue light blocking glasses. There's lots of really nice ones these days. Use blue light blocking filters and apps. I have them on all of my electronic devices. And if you do choose to use social media, be really mindful about the content you're taking in. Really cull your social media feed. Get rid of anything that is having a negative impact on your mood, your energy, your mental health. These are all really important things to be mindful of. Yes, I know you probably hear it all the time, but it makes a massive difference when you actually, really commit to it and start to be mindful. You'll probably be shocked at how much better you feel. All right, last topic of the day. If you have gone through all of this, you've corrected nutrient deficiencies, you've done your sleep study, you are eating a primarily whole foods diet, you are being mindful of your light exposure, you're doing all the things, and you're still exhausted, even though you're sleeping well. You may want to consider the possibility that you're dealing with some mental health challenges that are making you feel very tired. Depression is a really common one, but other conditions can also lead to fatigue, anxiety. A lot of people think, oh, if I have anxiety, I should feel like really on edge and jittery and more energetic, but that's not always the case. Often it makes you feel tired as well. So in this scenario, you really do want to speak to a professional. I know that so many of us have been socialized to just push through, white knuckle our way through it, but our mental health is so important for our overall quality of life. It's not something that you want to ignore or just try to push through. You deserve proper treatment. You deserve to feel well. So please do reach out to a professional if you're dealing with a mental health challenge. You can get help and things can make you feel better. There really are so many options out there. Okay, we have come to the end. I think I managed to do it on time. Looks like I did. I'm shocked. I probably rambled a bit, but I managed to finish on time. I hope that you enjoyed everything that we discussed tonight. I hope it was helpful and that you're leaving today with some useful information, some actionable tips to get you started. If you enjoyed tonight's content and you'd like to connect with me, there's lots of different ways that you can do that. You can head over to my website, kimvancend.ca. I've got lots of stuff on there for you to read through, get to know more about me and what I do. If you'd like, you can sign up for my email newsletter on my website. If you do use social media, you can follow me at kimvance_ND. I sometimes post on there, so that can be a nice way to stay connected if you use that app anyway. Or you can connect with me through Natural Choice Medical Clinic, where I run my practice. So I've included the clinic phone number and email address there for you as well, if you'd like to connect that way instead. Okay, well, thank you everyone for coming tonight. I hope that you had a great night. I hope that you learned a lot. It was a pleasure chatting about this topic. I have so much to say on this topic. Obviously, I filled a whole hour with the information, so it's something that I really love to guide people through, something I'm doing every day in practice. And so I hope that I gave you some foundational information that you can use. Thank you for being here. If you are watching this recording, thank you so much for sticking around through the entire recording. I hope everyone has a great night and enjoy the evening. Bye, everyone.